Hey, this is Coach Terry, and I'm here with Dr. William Workman, and he is the premier joint surgery guy in the area, known for fixing athletes and regular people and getting them back to doing what they do. And first of all, I'd like to say this is Dr. Workman, I'm Coach Terry, and how about tell us a little bit about your background? How long have you been doing surgery in Walnut Creek?
Well, I've been in Walnut Creek for 12 years.
12 years.
Now, I finished my training in 2000 and came back out to California to start practice. I went to undergraduate in the Bay Area and
Yes.
really loved it up here and wanted to make this my home. So my wife and I and my one-year-old moved out and back out in 2000, and we've been here ever since.
Excellent. You went to Berkeley?
Went to Berkeley as an undergrad, yeah.
Right, okay. And from what I understand, you take care of a lot of the athletes from Berkeley.
That's true. Yeah, I was an athlete at Berkeley. I was a baseball player there and played a couple years professionally before I went on to medical school.
Oh, so you played baseball. Who did you play for?
I was in the California Angels organization.
Oh, nice.
Yeah,
Okay.
it was. I deferred medical school for 2 seasons so that I could play, and then decided I better hang it up and get on with my education. So.
Excellent.
So I did all my medical training outside of California, which was a long period of time. I don't think most people realize. But
Yes.
10 years from the time I started medical school to when I finished
No kidding.
my training.
And you still look so young.
Well, thank you. So it was 4 years of medical school, and then 5 years of orthopedic surgery residency, and then another year of orthopedic sports medicine fellowship.
I see.
And then away I go.
So what made you decide on orthopedics rather than another?
Well, it's a good question, and I felt even back in high school, believe it or not, when I was a sophomore in high school, I was athletic, obviously, given my further career in baseball, and I was a pretty good student, and I liked science a lot, and I liked life science particularly. I loved the idea of how life works, and I'm also one to not waste effort, so I figured, how can I combine my enjoyment of sports and my enjoyment of science into one thing, and sports medicine seemed like a natural fit, and I kind of felt that orthopedic surgery would be the route to go, because I felt I would be able to take care of not only non-operative issues, but operative issues as well, obviously, that I would be precluded from if I wasn't a surgeon. So I decided to take the hard route and go the whole way and become an orthopedic surgeon.
Yes, and I'm familiar with a few people who have been associated with you, and one of the things that always comes up is that you look to do the non-operative type of therapy before considering surgery.
Well, I mean, surgery is a step that has much more implications than just about any other treatment. In terms of side effects and risks and things like that. And I like to phrase it as I just try to do what's appropriate. I mean, there are times when not doing surgery would be inappropriate, and you need to do the surgery. But there are often times when it's one way or the other, and it's really trying to balance the risk, the upsides and the downsides of a particular treatment. And a lot of times surgery has more risk than would be associated with a non-operative treatment, and we should definitely go with that. But I think it's doing what's appropriate and doing the least invasive thing, even if it's therapy or just whatever it takes to get you back, to get you out of the office and back out doing what you want to do.
Yeah, I'm intimately familiar with a couple of those procedures myself. Dr. Workman did surgery on both of my shoulders this year. One last January, about this time, pretty close to this time, and then the other one in June, and they both came out extremely well.
That's excellent to hear.
Yes, and I remember you mentioned that shoulders are funny. Shoulders can be very tricky and the recovery is hard. Could you explain a little bit more about that?
Sure. Well, one of the things that I enjoy about my specialty is that I don't just take care of one body part. I think in order to really understand any particular body part, you need to try to understand how everything goes together as a whole. And one of the things we know about the shoulder relative to other joints in the body is that it's much more complicated because of the simple fact that it has a lot more freedom of movement than any other joint, any other major joint in the body. So in order to accomplish that greater range of motion, it has to be less stable.
Yes, so we sacrifice that.
Yes, but it can't be too unstable or it doesn't work. So
exactly.
the thing that the shoulder does that other joints do is it accomplishes some of its stability using muscles and tendons as opposed to just ligaments and bony architecture.
Yeah.
And if there's any sort of disruption in that marriage between the muscles and the ligaments, then it can really screw things up, and a lot of times it's very difficult to decipher what the problem is and what exactly is right to get it fixed. In the case of a rotator cuff tear, it's pretty straightforward. But getting that shoulder functioning the way it should after it's fixed is what can be real tricky.
Yes. Do you think that there's a great patient responsibility there that has to be done?
Oh, there's no question.
Yeah.
And typically what I'm doing when it comes to the things I do surgically is it's just sort of putting the anatomy back where it needs to be.
Yes.
And then it's up to you and your maker to heal it properly, and then really up to your effort to get things functionally where they need to be. Of course, for you, Coach Terry, you're a very active guy.
Yes.
And you place a lot of demands on your body, sometimes a little bit more than I'm comfortable with.
Yes.
But you're going to be different than the next person that comes in and what they want to do. But in the end, it's going to be the amount of effort that you can put in as to how well you're going to do after something like that.
Yeah. So that period of therapy after a surgery requires discipline, and you have to be dedicated to make sure you do it every day. Otherwise, you're going to lose all that you put into it.
Yeah, I think I often find it funny that the same people that are allowing me to cut them open are the same people that don't follow my instructions after surgery. You think if you trust me enough to cut you open, you trust me enough that I have your best interests in mind during the recovery, and it just from the amount of time that I've invested in my life training and then practicing medicine, I have a pretty good experience with lots and lots of patients as to what is likely to be the best thing. And typically the patients that do the best are the ones that stay focused. They follow the instructions, they do their work. Most of the time it's not fun work to do.
Of course, it isn't.
But that's...
Yeah, but you do it.
Yeah, you do it.
If you want the result.
Just like when they're training with you.
Exactly. Yeah, I have the same problem about people not following your instructions and expecting the result.
Expecting results without work, it's a difficult thing.
Yeah, sure.